about ESD, right? But it could be about anything. But it's mostly about ESD because it focuses on cancer, I guess, probably, right? Okay.
Yeah, so taking it from a very far loop, it's the general task of a doctor to weight the positive and negative effect of doing something or doing nothing. This was developed like 40 years ago, almost 40 years ago, and was recalibrated later on, and includes diseases of the medical patients in the history, and also ages included. And yeah, if you look at this list, it is like very straightforward that the patients with these risk factors, which are of course weighted, each has a weight of 1, 2, or 6. One has severe liver disease, meaning cirrhosis decompensated, has a factor of 3. And these adds up, and each increases your risk or the patient's risk. And how good this prediction tool is probably explained by its C statistics. So for those you who do not really understand or not familiar with this term, C statistics is a way of looking at it like if you flip a coin, that's 0.5. And if your prediction is perfect, then it's 1. So and in the field of medicine, like probably you know the MELD score from hepatology, that is used to put patients on the transplant list above 15. That has, and it's probably the best C statistics tool in hepatology. It has a C statistics of 0.75 to 0.85 in different studies. And this has even better. And MELD score is very good. Every new model is compared to MELD. So C statistics of around 0.9 is like almost a perfect tool. Yeah, so it's really accurate. And in the next few slides, I'm going to use a punchline and trying to show you 3 things. First is that endoscopy can be compared to surgery. Of course, in some situations, it's even better. That ESD has a value in the elderly, and comorbidities do play a role in survival. Of course, these are very straightforward sentences, but I'm going to show you some examples in studies for that. And in the next, so those patients, even despite having an age of 87, patients with no comorbidities had an overall survival at like 80 months, so almost 7 years after, like 90%, which is, I think, very, very interesting. But yes, so those you see with comorbidities did worse. So yeah, again, comorbidity does have an effect, which is, yes, straightforward. And of course, but still, those patients did better than the ones who did not have any therapy. And now
that's very important, isn't it? Because it's often said to you as an ESD practitioner, what are you doing? Like doing this procedure on 90-year-old? Well, here's some evidence, some significant evidence that actually this is not age is a number.
Of course, this has to be discussed with the patient. This is probably looking at the same thing, but not from the point of view of lymph node metastases, but from the point of view of distant recurrence. And the NAT means no additional therapy. And you see that with no additional therapy, the risk of distant metastases is like 7%. And so those patients who had a completion TME had like 6%. And those patients who had an adjuvant chemoradiotherapy had 4% distant metastases. So again, the number needed to treat to have 1 to 3% benefit is really high. And of course, I think this was a meta-analysis from the Dutch group. Yeah. So comorbidities, think of them, include them, of course, in the assessment, and as probably with everything, we have to have an individualized approach in an elderly patient population.